Hello guys. So now we shall be discussing regarding the scalene muscles. Okay. So how many scalene muscles do we have? We basically have got three different types of scalene muscles. So our topic of discussion would be regarding the scalene muscles. Okay. So how many different types of scalene muscles we have got? We basically have got three different types of scalene muscles. So actually the only three muscles we have got? No, there are three pairs of scalene muscles. What are these three pairs of scalene muscles? One is called as the anterior scalene. Muscle. Next one is called as a middle scalene muscle. And next one is called as the posterior scalene muscle. So we have got three different types of scalene muscles. Anterior scalene, middle scalene and the posterior scalene muscles. So what is the function of these scalene muscles? All these scalene muscles are responsible for respiration. So these are responsible for respiration. How are they responsible for respiration? Because these scalene muscles are also called as the accessory muscles of respiration. They are also called as accessory muscles of respiration. These are called as the accessory muscles of respiration. And apart from accessory muscles of respiration, they also does one more function, that is called flexion of neck. This is called flexion of neck. They also do one more action, that is called as the flexion of neck. So as we discussed, how many scalene muscles do we have? We have got one is anterior scalene, right? Next we have got is a middle scalene. Next we have got is a posterior scalene. First of all, let us discuss about the anterior scalene muscle. Later on I will show you a 3D animation as well. Anterior scalene muscle. Now when it comes to the anterior scalene muscle, if you look at this picture, where is this muscle originating? See, this muscle is originating all the way from C3 to C6. For example, let us say this one is C3, this is C4, this is C5 and this is C6. Okay. So all the way from the transverse process, you cannot see the transverse process here, but I will show it to you in the animation. Okay. So from the transverse process of C1, C3, C4, C5, C6, it originates. And what is this? This particular rib over here is called as your first rib. It is called as your first rib. Okay, it is attached to the first rib. So where is the origin? Origin is from the transverse process of C3 to C6. Okay, and where is the insertion? And where is the insertion here? Insertion is to the first rib. Okay, so it is attaching to the inner border of the first rib. Inner border of your first rib. It is attached to the inner border of your first rib. Okay, so this muscle over here is called as your anterior scalene muscle. Now, for example, if anterior scalene muscle is contracted, what will be the function? What will happen to the structures over here? Where is this anterior scalene muscle attached? Anterior scalene muscle is attached to your first rib. This is your first rib. Okay, this is your first rib. If when this muscle is attached to the first rib, if there is contraction of this muscle, what will happen? The first rib will be elevated. Okay, so that is what you call it as elevation of your first rib. So the first important thing is called elevation of your first rib. Not only elevation of your first rib, see, this is the right anterior scalene, this is the left anterior scalene. If right anterior scalene is contracted, then there will be right side flexion of my leg. This is called lateral flexion. This is called anterior flexion. This is called lateral flexion. So anterior flexion and lateral flexion. If I am doing lateral flexion, it means the right side scalene muscle is contracted. If I am doing left side flexion, it means the left anterior scalene muscle is contracted. Okay, so that is why you call this kind of flexion as ipsilateral lateral flexion of your neck. So this is ipsilateral lateral flexion of your neck. Ipsilateral lateral flexion of your neck. Okay, this is called as your ipsilateral lateral flexion of your neck. Now, after the function is done, the next important thing is innervation. So, what is the innervation? Innervation is coming all the way from the anterior rami of C5 to C6. Anterior rami of C5 to C6. Now you might confuse what is anterior rami. For example, if you take the spinal cord like this, if you take the spinal cord like this, now you divide the spinal cord into two halves, right? So you are dividing the spinal cord into two halves. So here, this particular part which you can see over here like this is called as your spinal nerve, okay? This spinal nerve divides into two branches. One is called posterior rami, another one is called as anterior rami, okay? Now, the neurons that are present all over here, these are called as the sensory neurons. The neurons that are present over here are called as the motor neurons. The blue color neurons are motor neurons. The pink color neurons are sensory neurons. So, sensory neurons and motor neurons, where are they meeting? They are meeting in this particular structure called as spinal nerve. Spinal nerve. And what will happen? Is there only one neuron? No, there are thousands and thousands of sensory neurons. There are thousands and thousands of motor neurons. Now, what will happen is that some of the motor neurons, they go down, they go up in this way. In the same way, some of the sensory neurons also, they go down like this and they go up. So, what I am trying to tell you right now here is that anterior rami of C5 and C6. Let us say this is a segment called C5. Okay, anterior rami is, this is called as anterior rami or ventral rami. So, this is anterior rami on the right side. Here also we will have anterior rami on the left side, right? So, anterior rami of C5, C6, C7, anterior rami of C5 and C6. From the anterior rami of C5 to C6, we have an innervation, right? So, that is giving to your which muscle? Anterior scalene muscle. Now, after this anterior scalene muscle is done, the next important muscle we will discuss is your middle scalene muscle. Middle scalene muscle. Okay. Now, out of these three scalene muscles, the largest and the longest scalene muscle is the middle scalene muscle. So, middle scalene muscle is the largest and longest of the three. Longest of the three muscles. Largest and longest of the three muscles are your middle scalene muscles. Now, let us see the origin and insertion. If you remember anterior scalene, the same pattern middle scalene is also attached. See, this is middle scalene. Middle scalene originates from the transverse process of C2 to C7. Previously it was what? Previously it was C3 to C6. From the transverse process of C3 to C6. Now from the transverse process of C2 to C7. You see, that is why it is a little bit longer. But insertion again to the same rib, that is the first rib. You see, it is again inserting to the first rib. So the insertion is again same to the first rib. Same again, it is inserting to your first rib. Now, if it is inserting to the first rib, previously also the muscle inserted to the first rib. So, the first action which we discussed was elevation of first rib. Okay. Now, what I am doing is that here also it is inserting to the first rib. So, the first action will be elevation of first rib. Elevation of your first rib. Elevation of first rib. After elevation of, second important thing is that here what did we discuss? Ipsilateral lateral flexion of neck. The same function here also. Ipsilateral lateral flexion of neck. Ipsilateral lateral flexion of your neck. Okay. Next, coming to the innervation. The innervation is done by anterior rami of C3 to C8. The anterior rami of C3 to C8. Okay. So, all the way from the anterior rami of C3 to C8. Clear? Now, you understood what is C3 to C8 over here. Now, after this anterior and middle scalene, the next muscle which we shall be discussing is your posterior scalene muscle. Posterior scalene muscle. Posterior scalene muscle. Now, out of all these three, the largest and the longest was your middle scalene. Now I am telling you, out of all these three, the smallest and the deepest muscle is your posterior scalene muscle. So the smallest and the deepest of the scalene muscles. Smallest and the deepest of the scalene muscles is your posterior scalene. Now from where does this posterior scalene originate? Again the same. These muscles, they originate from the transverse process of C5 to C7. It originates from the transverse process of C5 to C7. Where are they attached? They are attached all the way to the second rib. They are attached all the way to the second rib. So look at this muscle. They are all the way attached to the second rib. I think I did not put a picture of the posterior scalene over here, but here you can see two important scalene muscles. This scalene muscle over here is called as your anterior scalene. This scalene muscle over here is called as your middle scalene. Posterior scalene I did not put. Okay, I will show it to you in the 3D animation. So this is your anterior as well as this is your middle scalene muscle. Okay. Now let me write down the actions and all, and then I will show you the animation of that. Okay. Now coming on to the function. Of this muscle. So where is this muscle attached? It is attached to the second rib. So obviously it will do the elevation of second rib. So it would do the elevation of your second rib. Again the same function, ipsilateral lateral flexion of neck. Ipsilateral lateral flexion of neck. Ipsilateral lateral flexion of your neck. Now coming to the innervation. Where is it innervated? It is innervated all the way to the innervated by anterior rami of C6, C7 as well as C8. C6, C7 as well as C8. Okay. So this is what is called as your, what is this? The posterior scalene. So what we will do is that we shall write down once again the anterior, middle and posterior, and we shall see where is it inserting, what is action will not see, but what is the insertion point, right, to which rib it is inserting, from where it is starting, right, and what is the innervation. So scalene muscles, in a box we shall write down these things. So the type of scalene muscles, origin of the scalene muscle, insertion of the scalene muscle, origin, insertion, right, and let us see the innervation of that. Innervation of this scalene muscle. Scalene, origin, insertion as well as innervation. The first scalene which we shall be discussing is your anterior scalene. Next scalene is your middle scalene, and third scalene is your posterior scalene. Okay. Now from where does this anterior scalene muscle will originate? Anterior scalene muscle will originate from the transverse process of C3 to C6. Okay. Next, where it is getting inserted? It is getting inserted to your first rib. And what is the innervation of this muscle? Anterior rami of C5 to C6. Okay. Next, when it comes to the middle scalene, where is the origin of middle scalene? Origin of middle scalene is from the transverse process of C2 to C7. Where it is inserting? It is inserting all the way to the first rib. And what is the innervation? That is the anterior rami of C3 to C8. Next, when it comes to the posterior scalene, where is the origin of posterior scalene? C5 to C7. And where it is inserting? This time it is inserting to the second rib. And what is the innervation? That is the anterior rami of C6 to C8. Okay. Now if you see, even if you just remember this particular table, that would be more than enough. Okay. So this is one of the very important thing. Now let us look at the animation here. So if you can see this particular muscle over here, right. So here this is a skeleton, right. So this is the neck region. Now in the neck region you have got transverse process. Okay, I will show you this transverse. You see, on the side you have got this process called as transverse process, right? Now what I am doing is that first let us look at anterior scalene muscle. Okay, so this is your anterior scalene. What did I tell you? You see from where it is attached, where are these anterior scalene muscles attached? From the transverse process of C3, C4, C5, right? So all the way they are attached down to the first rib. You see this rib is called as a right first rib. Okay, now what I will do is I will remove this clavicle and you can see the left first rib also. So this is right anterior scalene, this is left anterior scalene. Where are they attached? To the right first rib, to the left first rib. You see, they are attached to the right and the left first rib. This is your anterior scalene. After this anterior scalene is done, the next muscle which we shall be discussing is your middle scalene. Okay, so where is your middle scalene? You see, just in front of anterior scalene, you have middle scalene. See, this is anterior scalene and this is your middle scalene. Now from the back you can see middle scalene is arising from little bit upper end. Yes or no? That is why we discussed that the middle scalene all the way arises from C2, C3, C4, C5, C6, C7. But where are they inserting? See, anterior scalene and middle scalene are inserting to your first rib only. Both of them are inserting to your first rib, right? Now there is a gap between anterior and middle scalene, right? Just keep that point in mind that there is some gap between anterior scalene and middle scalene. I will talk about that gap later on. Next, after anterior and middle, the next scalene is posterior scalene. Where is the posterior? See, this is the posterior. You see, posterior is attached to which rib over here? It is attached to the second rib. You see, posterior here and posterior here also attached to the second rib. So, sir, how to see it very nicely? I will remove the scapula. Now you can look at that. You see, posterior scalene is attached to your second rib. So anterior, from this angle very perfectly you can see. Here that is anterior, right? So this is anterior scalene. After anterior the middle one is called middle scalene. Then back you have got the posterior scalene. So do we have any gap between the middle and the posterior scalene? No. But we have very enough gap that is present between the anterior as well as the middle scalene. Why am I telling you this is that between anterior and middle scalene, you have got a vein and this vein is called as your right subclavian vein. Okay, right subclavian artery. I'm sorry, not the vein. There is right subclavian artery. So let me look at the blood vascular system over here, so that cardiovascular system, so that you would understand it more better. Okay, so where is the cardiovascular system? I think it is on the top. So in this cardiovascular, yeah, this is the cardiovascular system. In this cardiovascular system, I am showing you the artery over here, right? So just look at this artery. Okay, fine. So let me remove this part of the artery also. Let us not put this artery over here. Let us not put this particular artery over here. Yes. So let me put this part. Right, now just look at this artery here. This is all the veins, right? So yeah, now concentrate here. I'm showing you one artery. You see an artery has come here. You see, where is this artery? You see this artery, right? This is right subclavian artery. Where is this artery located? The artery is located in between the anterior and the middle scalene. Okay, the same artery will be located on the left side as well. Now what I'm telling you is that now I will show you the vein also. Look at this vein. Now where is this vein located? This vein is also called as right subclavian vein. If that is right subclavian artery, this is right subclavian vein. Now where is this right subclavian vein located? It is located in front of anterior scalene. So behind anterior scalene, in between anterior and middle scalene, you have got right subclavian artery. In front of anterior scalene, you have got right subclavian vein. I hope you understood this clearly, right? So the same pictures are over here. Just look at this. So the same pictures are over here. Just look at this, that you see an artery that is coming over here. You see this artery, right? So this particular artery over here is called as your right. What is this artery? This is called as your subclavian artery. And where is this subclavian artery located? This subclavian artery is located in between the anterior scalene and it is located in between the middle scalene, anterior as well as your middle scalene. Now after this, just in front of that you have got this vein. What is this vein? This vein is called as your subclavian vein. Subclavian vein. Okay. Now remember one thing. Not only subclavian vein, along with subclavian vein you see a green color line which I am drawing. This green color line will indicate a nerve called as phrenic nerve. Indicate a nerve called as phrenic nerve. Okay, so subclavian vein and phrenic nerve, both of them are located in front of your anterior scalene muscle. Okay, they are located in front of your anterior scalene muscle. So subclavian artery and phrenic nerve, both of them are located. Subclavian vein and phrenic nerve are both of them located in front. Now, why am I telling you this is that whenever you are doing any kind of surgeries in the upper limb, any kind of upper limb surgeries you take, okay, so that time you need to give anesthesia. Where will you give the anesthesia? You will give such type of anesthesia called as blocks. Okay, spinal blocks. So where is the block you give? You give a block in between the scalene muscles, right? So that block which you are giving here is called as interscalene block. So near the scalene muscles you have got phrenic nerve, right? And in between the scalene muscles also you have got some nerves. So exactly you give anesthesia onto the nerve there. So what will happen? The entire nerve which is functioning to the entire upper limb, this nerve action will be stopped. So the entire, you won't even feel the pain. Okay. So those blocks are called as interscalene blocks. So in interscalene blocks, so if you look at the interscalene blocks, in interscalene blocks with the help of anesthesia, what are you blocking actually? We are blocking the group of nerves that are supplying your upper limb. The group of nerves that supply your upper limb are called as your brachial plexus. Right? So actually you are blocking this brachial plexus. Where are you putting the injection? You are putting the injection between the interscalene muscles. That is why this block is called as your interscalene block. So this is all you need to know regarding the scalene muscles, guys. So thank you so much for watching my video. Goodbye.